Last week, I was speaking to Dr. Kamat about recurrent candida infection, about how it's not just an infection.
So in these recurrent versions, I'm very sure that the patient presentation coming in can be very different because they could be Candida plus A plus B plus C, Candida plus D plus E plus F. It's syndromal, it's Candida plus plus, right?
This is what I think is the main issue there. We have to stop calling it an infection, like a recurrent infection. We have to look at the whole syndrome of things.
Candida is not just an infection, it is a syndrome of things.
Now again, candida, it can come, as I said, cortisol, your hormonal balances need to be checked. If it's very high estrogens, then we work on the liver, make sure the diet is clean. Again, we try as much we can with herbs. Working on heavy metals is another thing in this recurrent candida, because candida can sequestrate, which means it can hold on and then they can regrow.
Okay, Dr. Kamat, that is a earful, too much information. Why not we use a case study? Can you tell us about a patient you saw?
One of my patients who came in, she had all of these discharge, swelling, swelling of the vagina, burning sensation, painful intercourse, all of those symptoms, which used to be recurrent. And then she started the azole treatment. Azole is the medication. And after that, it changed to cyclical. So there's recurrent and then there's cyclical. The recurrent part may go away. It can only turn into a cyclical.
What are cyclical flares?
When the periods come in, they are fine. And the worst period is just before they get their menses. In these cases, it's very important that when you're working locally to help with the candida overgrowth, we also have to work on the hormones and all the other things.
Yes, and what are the other things?
So far, I'm hearing clearing biofilms, antimicrobial stuff, repopulating to balance the vaginal microbiome. And you said a little about
improving metabolism, hypersensitivity reaction.
She keeps talking about this reducing hypersensitivity. This is about your immune system and how in a recurrent candida case, some patients tend to be more sensitive to certain triggers.
Sometimes you're just very hypersensitive to the small amounts of candida that might be there. So you have to work on the immune side of things. Probably remove foods that might be contributing to this. And also stress response and anything that helps with the nervous system.
OMG. This goes way beyond candida already.
So that's why I say it's a syndrome of things, not just an infection that's happening locally.
Okay, here onwards in the video, I go on to ask her more detailed questions on yeast, biofilms, antimicrobials, probiotics, and also what to put down there.
You spoke a little about yeast elongation and hiding in different forms. Can you speak a little on biofilms just with regard to candida?
Yes. So biofilms is another thing where these microbes tend to have this escape mechanism. They produce these proteolytic enzymes around them, which can help them adhere to the tissues and hide underneath. So the biofilms have to be removed before we can get to them.
I asked her, what is good against biofilms?
NAC is a good one. And then there is also systemic enzymes. Serapeptidase is one of them.
Not just these, but also Chinese medicines. We use quite a number of Chinese herbs that are both antimicrobial and very good at clearing out the biofilms.
Bromelain and lactase, protease. Do you find that they're even useful?
No, they're not useful.
So I think this question is very relevant here. She is saying that digestive enzymes, which are often in anti-candida supplements, are not the top priority here. Digestive enzymes may improve your digestive system, but they may not be so targeted at clearing out candida. I continued by asking her what kinds of antimicrobials she likes to use.
So it doesn't have to be just the oregano. It can also be grapeseed extract because it's quite strong. So you can use that. And then I also use Bicol skullcap because it's also good for immune and also for candida overgrowth and also for lactobacilli overgrowth. A lot of herbs we have in our repertory, actually they are broad spectrum. You can keep trying a lot of these. Thyme is another one. Berberine related, Mahonia, coctis.
Some people use Paudarco or like black walnut.
Yeah, so as I said, it's not just getting rid of the infection. Again, you just improve the immune system, down-regulate that hypersensitivity also.
So she is emphasizing here again, if you have recurrent candida, you cannot just think about using antifungals to wipe out the candida. And even if you use methods that help to clear out the biofilms, it may not be enough. She is talking about a more holistic way to treat recurrent candida. The holistic way involves tweaking your hormones, tweaking your food triggers, tweaking your stress triggers, and that's really important. Stress triggers increase cortisol. Increasing cortisol increases the likelihood of flares. I go on to ask her about probiotic strains and what she likes to use. Again, you can find the different strains in different anti-candida supplements, which I have a list of in the description below.
Probiotic strains, Crispatus is the good one, or Ruteri is a good one,
Yeah.
Rhamnosus. Okay.
Yeah.
What do you
Yeah.
think of?
Yeah, so there are certain strains specifically for Candida. So there's Crispatus, Reuteri is another one, Gasseri is another one. So those three are pretty good.
And finally, I ask her a very sensitive question. What to put down there?
Typically like is boric acid suppositories. And
Yes.
the other things are garlic.
Okay, garlic down there.
Not many people like it down there, so it's
So, like, have your patients tried using garlic down there, and what are their responses, or what do they recommend? It's like, no, it's terrible.
some people feel it's very gross, but there are women who actually want to try and they feel fine. A lot of women are okay with it.
So in summary, what we learned from Dr. Kamat is that if you have recurrent candida, of course, you want to use antifungals, antimicrobials to clear out the candida overgrowth, but usually that's not enough. So you want to use stuff that clears out the biofilms that protect the candida and help them hide away. But that's not enough. So you want to add on probiotics, and she talks about certain probiotics that she feels are better. But of course, she's saying that this is not enough if you are suffering from recurrent candida overgrowth. You need to have 3 more additional interventions which are holistic. The first thing you want to look at is sex hormones. It's usually estrogen that you want to be looking at, and there are estrogen spikes closer to before your menses. And that is why she's talking about liver detox, because if you do a liver detox, you help balance out against estrogen peaks. The second one is food triggers, and this relates to hypersensitivity and the immune system. By reducing the inflammatory load, by staying off certain foods, you're going to help. But of course, the usual suspects are sugar, dairy, and wheat. The last one is stress trigger. Stress trigger is because when you stress, cortisol spikes up, and when cortisol spikes up, the likelihood of your candida flaring up again is much higher. Hope this video comes in handy. We have 2 more videos coming up that are related to this. One would be on recurrent bacterial vaginosis, BV, and the other, a case of BV and candida happening together. And these are some of the cases that come into the clinic. We help with Chinese medicine. It's not easy, so it's always a multi-pronged approach. And listen on if you're interested.